Healthcare workers have been the heroes of the pandemic, and in order to attract and retain workers, the state allocated $1.2 billion to give them bonuses.
Now, while the list of workers eligible has been expanded, there are still healthcare workers who do not qualify. Capitol correspondent Jamie DeLine explains.
Healthcare workers could receive up to $3,000 in bonuses for working during the pandemic, but not everyone is eligible for it. When it comes to the assisted living industry, Lisa Newcomb, executive director of the Empire State Assisted Living Association, explains.
The only ones that are the ones that are the Medicaid-funded assisted living program.
Since the healthcare worker bonus program was first introduced, more job titles have been added to the list.
Well, the state has since expanded the job titles that are eligible in that Medicaid-funded assisted living program. So we're grateful and thankful for that. But that, probably leaves, that leaves a good 2/3 of the industry where no workers are eligible.
She says she's been advocating for those workers to receive bonuses as well. Newcomb isn't the only one wanting to see changes. Recently, Assemblyman Angelo Santa Barbara wrote a letter to Governor Kathy Hochul asking her to reassess qualifications for service workers to include all staff essential to operations at New York hospitals during the pandemic. He's calling for employees of the Material Management Department at Ellis Hospital in Schenectady to be included under the classification of service workers.
The material management team really is a critical function of the hospital. They supply things like oxygen, linens, supplies to the floors. They were on the floors, on each floor of where patients with COVID, diagnosed with COVID, were present. They put themselves at the same risk that a lot of other workers did during that period and continue to do so.
In Albany, I'm Jamie DeLine.